Hello everyone, I'm from Jiangsu Bairun Medical. Now I will introduce the usage of patient warming system. Spread heating pad on operation table. The outlet direction should be consistent with the head of operation table. The side with label should face down. Fix 6 ties of the heating pad on the tracks of operation table. If tracks of operation table are occupied, you can fix it on the operation table with an extension strap. Fix other positions in the same way. Disposable towel sheet or operating sheet is usually used for correct laying. Connect the heating pad to the controller. Use with heating blanket. Heating blanket side with label should face up. Wrap heating blanket with a cover. The label of the heating blanket cover should be consistent with the direction of the heating blanket, and the label side should not be heated. After use, remove the heating blanket cover to wash or wipe with disinfectant, or use a disposable heating blanket cover. Take out the disposable heating blanket cover and turn the whole side toward the patient. Many used in non-operative areas of patient, such as the upper body, feet or legs. Connect the controller power and turn it on. With the arrow facing upwards, insert the aviation connector. Pull it out horizontally. Connect the controller power and turn it on. System self-checking. Output 1 normal. Output 2 normal. The last is the analog alarm. Output 1 on the left, output 2 on the right. Upper part, measured temperature. Lower part, setting temperature. The sun indicates the system is heating. When it reaches the setting temperature, it will automatically hide. Click Manual Temperature Setting to modify the temperature and press OK. Setting temperature range 35 to 40 degrees Celsius. The above are the installation and usage of patient warming system.